So Sam, I am kind of looking at your briefing, but I'm sort of ignoring it as well because chairs do that. It has been an amazing 2 days, and what I'm supposed to be doing is saying some closing words about next steps for Race and Health Observatory. But what I thought I wanted to do after hearing all this is I want to actually make 4 strategic commitments on behalf of the Race and Health Observatory without discussing with my board or the team or anything like that, because I'm a chair and that's what you do. So I think the first commitment is actually about our work globally. And this event has shown me that we must continue and actually deepen our international partnerships, strengthening our solidarity, our joint voice and our joint action to tackle racism and its impact on health. Thank you. We have heard some really harrowing data and examples of lived experience, but we've also heard illustrations of action that have succeeded, resulting in work that gives us all hope. A common ingredient that underpins all of the successful action shared over the last 2 days is the critical importance of not only working with our communities, but ensuring that they define and lead the delivery of the solutions. Co-production is already part of the RHO's work, but my second commitment is to ensure that we take our actual commitment to another level and work with our communities to establish a framework, including governance systems that ensure our communities define, lead, deliver and evaluate all our work all the time. So my third commitment is to focus on supporting leaders across the health service to implement, and actually given my new role, thank you the Mayor of London, actually not across health but also across care and local government, to implement our practical recommendations in partnership with their community. So it's now giving them their support, giving them our support, but actually helping them to do that with their communities, providing the tools, information, anti-racist approaches that enable, but also, as Victor says, act as excuse removers. So when our leaders try to use excuse removers, we can say no and they are held to account. My fourth priority commitment is to ensuring the information that we share with leaders really works towards eradicating discrimination and enabling proactive expectation with our clinicians and with our academics. So I'm committing, and I think we've already discussed this and agreed this, that the Race and Health Observatory will now impact on the education and continued development of all those who provide care. And secondly, we'll also explore how research is funded, actually who gets funded and who is involved in and leading research. Finally, with the next steps that we wish to take, and we are actually in conversation with NHS England to discuss how we can work with them to address discrimination and racism experienced by our communities who are employed by the NHS or actually members of our communities who they could employ. And of course, with those 4 priorities, of course, there's a actual theme throughout them all. Because although I'm standing there and making these priority commitments, they can't be priority commitments until we actually ask our communities. Thank you.
Thank you. Thank you very much, Marie. So I've got the graveyard slot, and the longer I talk, the closer keeping you from getting away. So I'm going to be brief. First of all, thank you. Thank you all to all those people who've listened and turned up. People say to me, when I envisaged the RHO, you must be so pleased that, it's turned out to be what it is, as though it was a surprise. It wasn't. There's no point in having small dreams. So this is exactly what I intended the RHO to be, a movement, a community which is well led, well managed, well administered, and that's what you're seeing. You're seeing black excellence delivering for everyone. Because I keep saying race isn't about me, it's not about you, it's about everyone. So that's what you're seeing the RHO demonstrating in its action. It's the most perfect action learning intervention we've ever designed in this context. So thank you to Yvonne and Dr. Williams. I think you've only been corrected once over 2 days in the schedule that you've effectively conducted on behalf of everyone. So just thank you. And Professor Williams, just effortless intellectual and personal grace, which I really appreciate. And Habib, I know how hard you work. I know how clear you are in your leadership, how determined you are, how calm you are, how smart you are. Thank you. You've done a brilliant job. The RHO team is just that. It is a team, and we operate and work like a team. Thank you, Marie, for your leadership, for being the chair of the RHO. We know that we've only just got started. What you've seen during the last 2 days is basically the start of a sentence in which the words consist of all you. We're going to need you, right? Don't think this is the end of something. This is the start of something. And we've managed to get some other people who normally would actually avoid this kind of thing. They would, let's be honest, to actually turn up and make personal commitments that we will hold them to. I think they'll hold themselves to, but we will help them basically hold themselves to the delivery of leadership. That's all it is. Let's not make it something that it isn't. This is about leadership. It's about doing your job. It's about doing your job on behalf of everybody, not doing your job on behalf of somebody. So I'm pleased. I'm quite nonchalant about this. This is what I expected. I don't expect anything less than this. And this is what you've provided. So I want you to go away empowered by what you've heard from Marie. We are your friends. We are your colleagues. We will hold your hand. For those of you that have come to this conference sort of leaving with lots of information but not lots of ways to do it, with big jobs on you. I see Patricia Hewitt there with the chairing an ICS. We will walk with you. We will walk with you. You're not on your own. You're not on your own. We will walk with you. We will guide you. We will support you. We'll provide you with the data. This is not a meaningless campaign. This is about actionable data delivered so that we can remove the excuses for better. So I'm delighted with this. I personally love you all. Thank you all very much. You're all stars. Have safe journeys home. Thank you.
You can't leave for home yet. We're almost ready to go. There's so many people to say thank you, and I'm speaking on behalf of Yvonne and myself, who co-chaired the international group that has worked. And this conference did not happen overnight. We have been working for months on Zoom calls, and I want to thank the people. If you think of the countries that members of the group are, finding a time that works well for everyone was impossible. And so for those in London, they generally join the meeting at 9 o'clock. For Priscilla in South Africa, she was joining at 10 p.m. And for folks in Australia and New Zealand, where it was 7 a.m. or 8 a.m., depending on the time of day, it was great for those of us in North America, right? We did well, Janet. But it took a lot of work. And it wasn't just Yvonne and myself and the team. Habib and his team were present at every single meeting. And we had multiple other meetings outside of that. So there's a lot of hard work that went into this. But my task today, as I say thanks to all of you who came and all of you who made this happen, is to really say a huge thanks to Lord Victor and Marie Gabriel. Without them, they had the vision. They are executing. They have put the team together, and without them, none of this would have happened. So we say a profound thanks to them. I want to leave you, before we go to one last video, with the words of Margaret Mead, and I have it not quite exactly correct. She said, "Never fear that a small group of people can change the world. It's the only thing that ever has." We can change the world. as we go forth from this place to make a difference, to improve health and health equity for all our populations wherever we are, and we can work in solidarity across the world.